In this section, we will look at the number and types of sexual safety incidents reported by mental health trusts in NHS England between 2017 and 2022, based on data obtained by Freedom of Information requests. Sexual safety incidents are defined as any behavior that is sexual in nature and that causes harm or distress to anyone involved. They can range from abusive remarks to rape and can be perpetrated by staff, patients, or visitors. According to a joint investigation by The Guardian and the British Medical Journal, NHS trusts in England recorded 35,606 sexual safety incidents in hospitals between 2017, and of these, 26,434 were reported by mental health trusts, which means that almost 3/4 of the incidents occurred in mental health settings. The data also revealed that nearly 2,500 of the alleged incidents involved staff sexually abusing or harassing patients. This is a shocking breach of trust and professional ethics that can have devastating consequences for the victims. The most common type of sexual safety incident reported by mental health trusts was abusive or degrading remarks, which accounted for 40% of the cases. However, more than 1 in 5 cases involved rape, sexual assault, or inappropriate physical contact, such as kissing or touching without consent. These figures are likely to be an underestimate of the true scale of the problem, as experts have warned that many incidents go unreported or underreported due to fear, stigma, or lack of support. Some NHS trusts also failed to provide a detailed breakdown of the data, or did not respond to the Freedom of Information requests at all. The investigation also found that only 1 in 10 NHS trusts has a dedicated policy to deal with sexual assault and harassment, and that managers are no longer obliged to report abuse of staff to a central database. This raises serious questions about how the NHS is protecting its patients and staff from sexual violence and misconduct. The data also showed that some of the most vulnerable patients were at risk of being sexually abused in NHS hospitals. For example, police recorded 180 cases of rape of children under 16 on NHS premises between 2017 and 2022, including for cases of gang rape. One former patient told the BBC how she was sexually assaulted by a male patient while she was showering in a hospital. She was in her early 80s and had been admitted after suffering a heart attack. She managed to fight off her attacker, but she received no support from the hospital and no justice from the police. These are just some of the examples of how NHS England failed to protect mental health patients from sexual abuse in its hospitals. The data reveals a disturbing pattern of violence and harassment that has been hidden for too long. It also exposes the need for urgent action to prevent further harm and to ensure accountability and justice for the survivors.